Mental health can be understood as a continuum. It begins with healthy, can progress to reactive, to injured, to ill. And it's dynamic, so we can move along that continuum. A person who is mentally healthy, they problem solve very easily. They have a sense of humor even when life becomes difficult. They have very low levels of anxiety. They know what to do when they're stressed. They're enjoying their life. It's a satisfying life, a pleasant life, even though life might have some difficulties. A person who is reacting, they might be experiencing some anxiety. They might have a little bit less energy. They say to themselves, I'm really doing okay at work, I'm doing okay, maybe if it's a child at school, but something isn't quite right. It's kind of like a low-lying cloud over their lives. Someone who is injured along the mental health continuum, what they're experiencing is more intense. It could be anxiety, it could be sleeplessness, it could be less energy. It could be start wondering, are people talking about me? They're uncomfortable and they're saying, I'm really not doing so well. Work is much harder. I get too anxious about work deadlines, and I'm functioning less. I have less decision-making ability because I'm stressed and I'm not well. Someone who is ill along the mental health continuum, they are not functioning. There's the definition of mental illness when thoughts, feelings, and behaviors are affected so that daily life is disrupted. And that's the key piece. Daily life is disrupted. Common causes of mental illness can be biological, environmental, or genetic. Some of the biological factors that can cause mental illness is it might be a side effect of a medication. I've talked with folks who are on steroids and they feel anxiety. Doesn't mean don't take the steroids because they need them for another reason. So it could be a side effect of a medication. We've all heard about sometimes hormones are out of balance, postpartum depression or anxiety in the postmenopause years. It could also be related to a neurological disease like Parkinson's disease or Alzheimer's. And the other one that I think of is substance abuse. Environmental factors can affect our mental health as well. Environmental factors might be, I think of Prince Harry, who lost his mother at a very young age, and he's talked about how he became so anxious he couldn't keep his royal engagements as easily as he used to. So again, that's an environmental factor. Relationships, it might be abuse, it could be psychological, it could be sexual, people who are involved in assault or combat. Or when we experience losses, such as it could be a job change, it could be a school change for a child, it could be a divorce, it could be a death. Again, when those things affect us so much that it's making it difficult for us to function every day. Genetics play a role in our mental health because family history. If we've had a parent or a grandparent who might say had a severe depression or schizophrenia, bipolar disorder, it puts us at risk for having that same mental illness. It's really just like heart disease. If somebody in my family has heart disease, it means I could get heart disease and I just need to be aware of how to take care of myself. Mental health is a really important topic to normalize now more than ever, I think, and the statistics are really quite startling. 1 in 5 adults will have a mental illness episode in any given year. 1 in 6 children ages 6 through 17 will have a mental illness in any given year. And I think the other statistic that makes me really want to normalize mental illness is the fact that oftentimes it's 11 years before someone gets treatment. Exercise can make a great difference in mental health. When we exercise, it changes the brain chemistry. You hear people talk about endorphins, also elevates serotonin. And when we're changing those brain chemicals, we're changing our moods and we're affecting our mental health. Sleep is another great way to maintain our mental health. There have been many studies that when people are deprived of sleep, that it begins to affect their thinking and their feelings and their behavior. Balanced diet is incredibly important for the brain. And the one that's been most talked about in the studies that I've read is the Mediterranean diet. It's definitely low in sugar, it's low in processed food, it's high in the good fats and fruits and vegetables. Connection with friends and family is really important for our mental health. It can be during times when there's adversity and when we're not having adversity and difficult times. There has been research through the positive psychologists that's saying our social connections are a key driver for our mental health. Identifying triggers is a great way to maintain one's mental health. And what I mean by triggers is, if I'm noticing I'm more anxious, I'm having more nights where I'm waking up rather than sleeping through the night, or I'm not performing as well at work, it'd be really easy to judge those things and get frustrated. Whereas what I'm saying is I want to identify those sort of as friendly cues. My mind and my body is telling me something. And they remind me to say, oh, maybe I need some help. Working with a mental health provider can be really key for someone's mental health. A mental health provider has spent a lifetime studying what helps the brain, what helps the emotions. We believe that a healthy body is a healthy mind. ConnectCare3 offers services for folks facing a medical diagnosis, as well as manage a chronic disease like diabetes. Their services also include tobacco cessation and nutritional counseling. ConnectCare3 is a confidential service provided by your employer.